Good afternoon, everyone. Thank you so much. So I am Prabhat. I run a software development company from last 19 years, and I'm fortunate to have a lot of leaders today on the panel. I have learned from all of them from last many years. So we are catering to around 200 plus hospitals, around 8 to 10 countries. And recently, cybersecurity is something which is very much required in each of the software um, for any procurement from right from the procurement life cycle till the implementation. There are a lot of implementation that we did many years ago. Now everywhere we are getting a lot of VAPT and a lot of other compliance requirement. Now, I don't think I need to emphasize more on cybersecurity part, that how it is important and all, without taking much of the time. But one thing is very important, that today, when we go through Microsoft had recently reported that even Edge was compromised. All of us are using Microsoft Edge. We are iPhone users, Android users. Everybody is very openly telling that they have certain vulnerabilities. We need to keep on, enhancing those. Hence, we have a lot of leaders and I want them to focus more on that. So I'll start, with Mr. Vishal, just to give us some insights that one of the cutting edge sword that we have it, that's we want to get digital. With each and everything, we want to go digital. So with this transformation in IT, how the cyber security is a double-edged sword for us actually. So if you can please throw some light on that, sir, it will be very nice.
Okay. Good afternoon, everyone, and thank you, Prabhat, for introducing us and being the moderator of this panel. And the good thing is we are discussing cybersecurity in healthcare this year, and not the typical AI and EMR adoption, and that shows the the relevance of this topic. We recently had so many incidents in India. We all know AIMS, we all know Sun Pharma, ICMR, and Safdarjung. So all these incidents were bad for the country, but they did a kind of a good thing. Now we started, discussing cybersecurity openly. Earlier, it was a kind of a back of our mind always, and we were, in our daily busy schedules of IT as well as for the hospital owners or the hospital CEOs. It was a priority, but it never became a priority. That was the situation. So to give answer to your question, cybersecurity, why it is relevant, and before that, we need to understand why it is happening, especially in the healthcare industry. Two, three things. The first thing is there is a tremendous growth of the attack surface, especially in the hospitals. Uh, there are so many initiatives taken by the government of India, like digital health initiatives. On top of that, there are so many initiatives which the private corporates are taking, because every hospital, they want to increase their patient experience. They want to optimize their operational workflow. They want to reduce their cost, and the IT solutions or the IT products are the only way to achieve that vision. And hence, on daily basis, we keep on adding so many products, so many solutions, so many services. And we have the business owners, be it nursing, be it biomedical, be it radiology department. Everyone, they come up with their own solution, their own services, and then they pressurize some way to the IT team, to deploy those solution on an immediate basis. So that is a major issue in the healthcare industry. The second thing is the healthcare solutions itself are very complex, and for the integration, and very complex for to have the desirable security posture. So that is the main reason for that. And if what we can do is, there are so many trainings programs, there are so many awareness programs, there are so many assessment programs these hospitals has to do. And we need to remember one thing: there is no other way. Only assessment, mitigation to the finding of those assessment, and continuous training to the staff, to the nursing team, specifically to the back end team, as well as doing so many training programs within the hospital. I think that would be the only way to survive.
Right. Thank you so much, Mr. Vishal. So I was interacting to one of the cybersecurity experts, and I was amazed to know that he's keeping two phones now. One Nokia, that basic phone without internet. He says that he has not enabled internet on that phone, and he's using it for banking services only. Are we actually going into that era where we need to switch off ourselves from the internet, because that is the only way to save? You know, because, or there are other means actually. So we are going to explore all of this, and we are also trying to cover certain things as an individual user, how we can safeguard, because today we have given phones to all our kids actually, and there are a lot of apps that they download, and those are like beyond our control, and lot of mishappenings are happening. So we have Mr. Prashant, and we are very lucky to have him. I know him. The good part is I know all the panelists from last many years, and Mr. Prashant, I know he has worked a lot into different organizations. So I really want you, sir, to focus more onto AI thing, and because everybody is talking about AI, I was making out the questionnaire, and I also consulted AI because I don't want to miss out anything which is there, So, Mr. Prashant, if you can, with your immense experience, throw some light on AI and other ways how we can safeguard ourselves, and also on one point that whether AI is actually going to help us, or again is it a double-edged sword that it is going to actually steal all our data, and then we are going to be more vulnerable actually. Mr. Prashant.
Thanks, Prabhat. Good afternoon, all. So, I think in today's era, AI playing a vital role in all the verticals. You beat security, you beat applications, or you beat your other systems, which are there and evolving with every passing day. So, AI, I think, in my view, is gonna play a vital role. Since we are talking about security vertical, so in security vertical, you talk about detection and response system, the threat detection and response system. So there also AI playing vital role. So if you look at traditional approach of covering up your network, your infra, your security layer, it used to be quite primitive. Somebody used to be there manually managing each and everything. There was no record what sort of events are taking place in the system. But now there are AI and ML based systems which are really helping in each possible way. You look at SIEM systems, you look extended detection and response systems, which are far beyond our expectations. These AI based and ML based system can calculate vast amount of data and pick up the stuff which you are looking at. It can quickly detect the threats quite swiftly. So this is the place where AI playing vital role. So and you look at other areas like in healthcare, how you can diagnose something basis the input of vitals, basis the input of various results. So there also AI is helping. So Prabhat, in my views, AI is going to add value going forward. Yes, there are some negativity as well in the market. It will definitely do something in resource management. It will reduce the jobs in the market. But I don't believe in this. I feel like it would rather ease down the job of people, because people and technology have to go together. Without people, technology is useless. Even if you talk about AI too need algorithms. Algorithms need brain. Brain means people. So I think technology alone cannot work, and AI is something which would definitely ease down the job of people. That's it from my side.
Thank you. This is indeed very insightful, actually, that AI is learning day by day. The algorithms are getting stronger, and it should help us out on the real-time basis of detecting it and doing the immediate, way of resolution. The next panelist that we have is powerhouse of information, especially on this topic, actually. I have heard him many times, and we are lucky to have him today. So Dr. Susil comes with immense experience and background because he's handling AIMS. All of us know the kind of challenges the organization has faced and had come out to be more stronger. So, sir, over to you.
Thank you. The way you have presented me, uh, I'm just like you, but during the last 32 years, I am in the healthcare, and simultaneously, I am working in the health security also. I'm thankful to Elite Groups because since 2006, I am every time joining as a speaker in this type of events. The first 2006 I have given the telehealth, and today I am giving the in the topic of cybersecurity in healthcare. What is the cybersecurity in healthcare? In my opinion, it is a new normal. Means attack will happen, you have to accept it, but how to get rid of this attack, that is the main challenge for you. That's required the more alertness. One of my friends, Siso, he has told me that I'm spending around 22% of my IT budget in cybersecurity, and I'm more secured. I have everything. I have endpoint security, I have an MDR, XDR, I have a next generation's firewalls, I have SIM, I have SOAR, DDoS attack protections, SSL protections, everything, data encryption, everything I have. How I can be attacked? I can't believe it. After 2 months, he has asked me that one server is compromised, what to do? Nothing is secure at today's days. I think everybody, they have a mobiles at your hand. How many people you have secured your mobile? Can you raise your hand? See. And most of the mobiles you are using UPI and you are not secured. I must have heard many people, they are saying that within 5 minutes I got a call and everything's finishing from my account. Why you are not protect yourself? It is called endpoint security system. You're supposed to protect your mobile with some application. Try to understand, very seriously think about it. Simultaneously, our organization is supposed to look into that area, that how to secure each and every assets of IT. So this is my first first what we want to communicate you, that you have to accept it, that attack will happen, and how to get rid of that attacks, that solution is supposed to be in ready. Many organizations, they have given 4 steps. That is identify, then detect, then protects, and response. The four, this is very common and everybody knows it. And every solution is in hand. But still, we are getting the attacks because attack surface has been changed drastically. People are using AI tools. It is very fast. Earlier, when you are attacked in ransomware, it was taking 3 to 4 months. They come through a malware or a phishing. They stay at your infrastructure. After that, they will get an attack after 3 to 4 months. Right now, it is not even 2 to 3 days. So how fast you can react, that is just challenging. I think I have communicated many things to you. In the next round, I will tell something else. Yeah.
Thank you, sir. Thank you very much. That's really insightful. And, we know even if whatever latest updates, patches that we do, still we are vulnerable. So the next panelist that we have is Mr. Srini, and he has, dual role in the organization of CIO plus CISO. And, that makes more, I think, challenging, but in the same way, easy also. I want you to focus more, give some light on how, there are a lot of trainings that we undergo as a part of the cybersecurity compliances. And what happens is, when we talk about healthcare, we have even a ward boy is one of the important person that we have, and he also has some access to the application, nurses, and lot of other ground staff actually. So how can organizations actually prepare to train, even if we go for any ISO certifications, what happens is for few days there are some trainings, but again there are a lot of gaps happening. So we really want you to focus more onto how we can, and manage the entire hospital staff in terms of the compliance ready thing actually.
Thank you. Thank you for that question, because that is a very important question within cybersecurity. Touching on the compliance aspect itself, you spoke about ISO 27001. There are a number of security certifications in the market. which are useful. I mean, not just from a healthcare perspective, but for any industry. That helps ensure that you have a certain minimum standard of cybersecurity within your organization. But like you rightly said, many times when you go in for certification, you go through training, and there's a whole lot of noise around getting everything compliant, systems patched, people trained, and then after 2 months, then it just gets lost, right? So how do you ensure that people are equipped? Because these compliances have to be implemented by people on the ground.
Correct.
And with healthcare as an industry, it has the highest churn in any industry, right? You have healthcare professionals. If I look at caregivers or nursing staff, we sometimes have around 50+% churn in a year. So you have to train, you have to retrain, you have to make sure that people are aware of your cybersecurity policies, your tools, your processes, and what they're supposed to do. Right? From a people perspective, it is actually a big vulnerability because people are the weakest link. And sometimes, and most times, it is unintentional breaches because people don't know what they're supposed to do. In your hospital setting, you might have clinical communities that use WhatsApp to share patient information. Right? It is very easy to use, but at the same time, you are exposing patient data, patient health information on a platform that is public. Even though there is end-to-end encryption, the way in which that data can leak out is quite high. I mean, the risk for that is quite high. When you look at how emails are being used, how you are exposing social media access on your infrastructure within your hospital, right? So taking a step back, there are policies that need to be in place in your hospital environment that are aligned with your cybersecurity needs, with your cybersecurity vision. So you have those policies that prevent the usage of certain things within your network. In the same way, you have tools that prevent the leakage of information from your technology solutions and from your systems into the outside world. While those being in place, you have to continuously keep training your staff, train, retrain, to make sure that they understand their roles, their responsibilities, and the consequence of their actions. So one of the things that I've seen as quite effective is that when people realize how this impacts the hospital operations, how this impacts the privacy and security of your patients, then there are a lot more inclined to follow it. Otherwise, it is seen as an additional burden that they have to get exposed to. Flipping it on to the management side, and many of you here are administrators, many of you here are clinicians. It is important for all of you in the audience also to recognize that cybersecurity is a very real threat. So when budgets are needed for cybersecurity, when people need to spend time for training, you have to make sure that you let them do it, you allocate time to it. Otherwise, you will have an organization that still continues to be vulnerable. So just to shorten, I think it is people, training, tools, all of that in place, but awareness is very important, very key to this.
Yeah. You want to add something, sir?
There are two good points which Srini touched upon. One is the certification, the second one is the training. Whenever it comes to the certification, there is very unfortunate, especially in the healthcare. We do the certification just for the sake of certification,
Absolutely.
just for the sake of document.
That's right.
The ideal way of these audits, especially the ISO 27000 kind of audits, should be to really find out the gaps and to find out the mitigation. Sometimes it really helps the IT people, to fight the case for the appropriate budget from the management. So that is the one of the approach. Similarly, the policies framework. The policy should not be just for the sake of documentation in the hospital. We need a NABS certificate, we need a JCI certificate, so we need to have these 5-6 policies in place in terms of the documentation. That approach should not be there. The policy has to be implemented with the end user properly. I think that is the key.
Absolutely. You want to add something?
Yeah, Srini has rightly stated that the awareness from the user levels. Because doctors, nurses are too busy and they want the work to be done as early as possible. 92% of the attack does come from the user side, endpoint side. Because the malicious software or phishing. The links which are unable to detect it and they click it, and you're allowed to the attacker to inside your system. So that's why we need a social engineering, proper education, training, and awareness. And periodically, you have to give some kind of self-generated phishing mail to users, test them how they are aware. Because sometimes what it happens, they have got a training, they have got a awareness. After a few months, चलता है ये. तो इसके बाद क्या होता है, they are not serious on it. So periodically, you have to give the continuous training programs, some workshops, some type of virtual sessions. Then people will be more alert that okay, I have to be more careful in this. Thank you.
I think this is very important. So, as an organization, we cater to the largest of the large hospital chain across these countries. We cater to Apollo, Max, Aster. We cater to SCG. We cater to a lot of organizations across. And recently, what we have done is that from all of these organizations, we are getting some VAPT checklist. So we have compiled that, and we have created a master checklist. So what happens is, if Fortis has sent us, say, 20 points, which he has got it done from PwC, and Apollo got it from, say, McKinsey, and, Aster got it from some other vendor. So as, service provider, the good part is, what we did was, we created a master checklist, and we were trying to figure out if there is some master checklist that is available in the industry. And, if we can share with all of this, what happens is, in each of the checklists that we get, there are some or other points which are missing. And one of the very important point which Mr. Srini said, and which has been covered very well by Mr. Vishal and Mr. Susil, is the biggest thing which Mr. Susil said is absolutely right. We invite the hackers actually. What happened with one of our client, which is, an international client, more than 41 hospital chain. One of the employee who left the organization 2 years ago because they did not had SSO implemented or password policy implemented, because it was, say, 5 years old, system, that could be accessed. So these are very small, blunders that we do at many times. The good part is that in our panelists, we also have somebody from the government representing us. So I would really want to know if there is some checklist available, what are the compliances available, and what are the consequences if we don't adhere to it. One very important point that we want to ask you is on the DPDP bill actually. Because, all of us have read, in case if we breach out any of this, what is the kind of penalty that we have? Anybody from the audience? Can you guess it out? There is more than 250 crore of penalty for single breach as per the DPDP bill. So we just want to know that all of us are from somewhere from the private side, apart from Mr. Sushil, who represent both. But then we want to know how, practical it is, and if there is a checklist, and what are the consequences. Mr. Akhil.
Thank you for this opportunity, Mr. Prabhat. It just reminded me of a parallel between cybersecurity and healthcare. It's only after you lose it that you understand the value of both of them. It's after you have a breach, then you realize, oh, I wish I had a cybersecurity policy. And health, it's very obvious that after you're sick, it's too late to buy health insurance or get fit. But having said that, from the government, we have a lot of rules and policies. For example, at NHA, we have the National Digital Health Health Data Management Policy, and also there are various laws. For example, now we spoke about the DPDP, which got passed into an act recently, and then you already had the IT Act 2000, which was covering data as a whole, and health data is one particular component. So one thing, we had a closed door discussion regarding we have such great policies and very elaborate language used, but then one hospital owner actually asked me that this is jargon for me, this is a legal document, but what does it actually imply? So then we started thinking, how do we simplify this? For example, one particular mandate we have as part of the Ayushman Bharat digital mission is that you need to do a yearly web application security assessment. So one of the hospital actually is saying that we can't afford doing that every year. And our logic was saying that every year the threats are evolving, you'll have to do it. But that's actually, it's a really hard thing to do. And post that, this was actually from the health commissioner in Karnataka, where he said, you have such great policies, but we do not have CISOs or enough cybersecurity professionals to even do this. For example, Dr. Susil is part of AIMS, and AIMS being a large institution can afford it, or they have the mandate. But the capacity in the States is very, very bad. So again, the shortage of cybersecurity professionals itself. And third, regarding health policy itself, so hospitals are first evolving to digital health recently, and not everyone's aware of digital. And they're like, first let us get into digital and then let's get into cybersecurity, because it's like a level 2 problem for everyone. So having said all that, so at NHA, we have our digital health policy, we have the DPDP Act, and thanks for pointing out the fines are up to 250 crores, which can potentially close down a company also if you don't comply by DPDP. And also, if at all if you feel the rules are not notified and not clear, you still have the IT Act 2000 and different Supreme Court judgments which actually protect your data. Very critical thing that I want to point out, the difference between health data and data in general is that, for example, your financial data also can get stolen, and that's very critical because people can assess your network. But health data is even more critical because that's a relationship that you have with your doctor and you. So you don't want that data to get leaked. And the various simulations that we had, various questions that were raised to us was that if I actually know someone's health problem, it's actually a social stigma based on the disease, and you can actually be socially boycotted. And also, if it's a national threat also, if I can actually find, if I can go back to COVID and how it was engineered and how things can happen. So that's where cybersecurity comes into play. Having finally said all this, I believe the encryption or the anonymization that should happen at the edge. So if at all there's a cybersecurity breach that happens, that data is gibberish because you cannot really point it back to another person, and you cannot do this on a centralized level. So these are the various things that we have. I'll be touching about two more organizations that are very critical for this. One is CERTIN, which is a body under MeitY, which actually gives us this checklist that you spoke about. And also NCIIPC, which is another body under NTRO, which decides which infrastructure in this country is critical infrastructure. For example, the power sector comes under that. NHA also looks at the Pradhan Mantri Jan Arogya Yojana, and that's been designated as a critical information infrastructure. So they have a huge checklist. They do a big audit every year to assess these. For example, compared to other government bodies, anything which is assigned as a CII has to go by other stringent measures. So, and also the web application security assessment that we do, CERTIN has empaneled certain organizations to do this. So CERTIN gives these checklists as part of the application security assessment, and that's how it happens in the government.
Great. Thank you so much. I sincerely believe that, going with the kind of challenges that we are facing, any country today can actually crib the other country's system if they attack on the cybersecurity. And hence, I believe that cybersecurity can be a ministry, independent ministry controlling all of this. I remember with Dr. Ravi from Elets, I used to present to mobile, World Bank 15 years ago. I was talking with Dr. Ravi that, we used to promote mobile governance then. And I'm talking about 15 years ago. Then mobile governance was not even coined actually. People were talking only about e-governance. Hence today, I don't think it is too early, but then cybersecurity actually from the government side as well, it has to be taken very, very seriously, because there are already a lot of, incidents which are not known in the public domain, which already we are facing actually. Right. So the next panelist that we have, when personally I was going through his profile, I, was very keen, because as an user, all of us have always some time or other way have used Dr. Lal Pathlab actually. The kind of, reach that Dr. Lal Pathlab has is immense actually. Now, because you dedicatedly are talking about CISO, your role, you are one of the panelists who are dedicated CISO actually. So as this role, cybersecurity, what is your overall, challenges which you are and how you are handling in your organization? Especially, we were talking behind the stage was that they have centers at the remotest of the corner of India. And the center in charge can fetch out the patient data on click of a mobile number, right? He can fetch out the historical detail, the report, and he can print. So, in general, what are your recommendations and how you are actually protecting it, Mr. Pushkar?
Thank you. This is a great question. I think we are at the inflection point where while we continue to use data to propel the business to the next level, it also comes with a humongous amount of responsibilities to actually
I
safeguard the
think
data.
Mike, you can just check one. Yeah, this is okay now.
Am I audible?
Yes, yes.
Okay. So without repeating myself, obviously we understand that the importance of data to run the business forward, but it also comes with huge responsibility to sort of handle it properly. And that's where we get extremely serious. Keeping it journal, any industry that thrives on data, um, and that's largely financial sectors, retail, manufacturing, and on and on. Uh, the way to deal with is to have a very holistic approach to it. Now, that holistic approach starts with the entire data lifecycle, how the data is generated, and then how the data is eventually get rid of. And around this data lifecycle, there are tremendous amount of participants. Your internal participants, you have stakeholders, you have partners, you have vendors, you have a special interest group, and so on and so forth. So you basically not look at it data in a single focused way. You look at it in multidisciplinary format. And when you do it, you sort of develop a defense in depth strategy, right? Now that your question is predominantly around data, but you can also actually expand that to cybersecurity also, where you have a defense in depth model going on. So look at it, who are the ones who are actually generating the data? And before you even start it, how do you know which is the data that you really have to worry about it and sort of deal with this protection? Not every data that organization generates has a great significance. So it starts with identifying, classifying your core data. We call it restricted data or confidential data, and then systematically finding the right controls to it. And they can vary from encryption to masking to anonymization, having a right kind of access control, so on and so forth. And most importantly, least privilege. So you sort of talked about our depth in terms of how far we are in pan India, and in fact international also. This is what exactly plays a very critical role, that we are very focused in terms of who get what kind of access to data. At the same time, they should be able to do their job. Otherwise, what is the point of doing the business? So that's actually very important. And then eventually also linking it to how our partners and the third parties are handling it, right? And that's when you sort of create a, what I call it, a simple 2x2 matrix, and have your partner identified in terms of process and data that they have access versus the kind of control they have internally. So if you have some partner who has a huge amount of access but brings in a very poor control, then you know that to what degree you need to continue to do the assessments and sort of have a continual improvement around it. So that 2x2 really is very helpful. There's the one part of it, and then data at the end of the day is also a liability. If you have the data, you have to protect it.
Absolutely.
Keep a data minimization in mind and sort of get rid of the information that you really don't need. So that's predominantly my suggestion around handling the data.
That's really insightful. That's really insightful actually, because I'm sure you must be taking continuous trainings also for your satellite centers across India and abroad, because then only you can adhere those guidelines. All right, so we have next panelist, very dear friend of mine, Mr. Lakshman. I know he takes a lot of panga. He does a lot of innovations. He is one, I know him, who has integrated SAP into healthcare first time. And he always take a lot of challenges. I know him from last 15 plus years now. One of the important, aspect today that all of us are dealing, as if I run a company and then I have to budget out. I have to budget at least 4 engineers all the time, so that we can keep addressing the VAPT points. They are not into development, they are only just addressing the VAPT points. And there is a huge cost, because these are very specialized resources. Now the question that I have with you, Mr. Lakshman, is how are you dealing with the management buying in? Because already IT, whenever they create a budget sheet and they go to the CFO and to the management, they already cut down a lot of things. And cybersecurity until recently was not a head actually. Now this is becoming a prominent thing. So if you can throw some light onto it, with your experience.
Thank you, Prabhat. You rightly said that taking a budget for security, or especially for security, is a challenge because, as Mr. Akhil said, that healthcare is now entered into a digital era. Now, the first priority is we have to go for the digital. We have to do the patient journey. We have to make the patient journey easy. We have to give lot of things to the patient. We want to give everything on his hand. So this is the thing when we talk about the management, boss, we need this type of budget. So first priority is to give the automation. But now these days, management now think after some events, now they are really thinking that cyber security is a head. But before that, we have to give some sort of things like we have to do the risk assessment. We have to tell the management, boss, these are the risks we have to mitigate from this. These are the cost analysis. Suppose if any attacks comes to us and our data leaks, our data hacks over there, so how much cost we have to give for that? So these are the things and the trainings and the cyber security is not just for a say ki, okay, we this year we will go for the cyber security. It's a journey. We have to go for the trainings. We have to we have to train our end users. So to take the budget from the management, we have to go for a multiple. We have to make the policies. We have to make the risk assessment. We have to go for the audits. Based on these things, we have to ask and we have to ask the management that we need this type of budget. Then they will give the budget. Or you are absolutely right that if 2 people or 3 people are sitting only for VAPT, or a person is sitting only for analyzing the this my logs, server logs, my these type of logs. So these are these are like a cost for management. But now these days, these are the things which management is also accepting that we need to do go for that.
The best thing that he said is, you tell the management that this incident may happen, and that organization already had faced. So that is the right way, and I think they will very well approve it. So that's the best. Yeah, please.
I mean, those were some good point. I just wanted to, add something from my experiences that, um, sometimes there is definitely a struggle, but it also depending upon how well are we presenting the risk, how well do we really understand the business. The cost of breach is definitely one point to go, unless we have a very fair understanding of the cost of breach and the amount that it can have impact on the core business processes. Until then, it doesn't really move the needle any further. Most of the time, where the things don't work out is when we have a very technical approach to things.
Right.
Ransomware means nothing in general. VAPT means nothing in general. But when you start to linking with the core business process, the patient care, patient life cycles, and how some of these things impact it, and when you sort of present that with the amount of data, then it starts to create the conversation. When the conversation happen, that's when you know that you have sort of have a foot in the room, and that's actually the way to move forward. And also, it's a responsibility on the professionals in this particular context, the cyber professional, to continue to educate the board, educate the executive management what it means, constantly sharing information with them. That's when people will have a rather smoother ride.
Great. So I think Anupama, what she did was, while we were starting, we said she will give us 45 minutes, and we said we will give 1 hour. But when we saw the clock, she actually had given us 32 minutes only. So she was very smart into this. But from the audience, in case if you have any please. If somebody can please give the mic.
Thank you. I think it was very enlightening. Myself, Dr. Partho Roy, I am looking after the operations and projects for a chain of laboratory. So what I understood is that the basic cyber security problem actually happens at the ground level, at when people who are working with this. So in a very simple manner, I would just like to ask that, we have NABH, we have NABL, people are using HIS and LIMS, LIMS. So they have inbuilt security system, but then it can be breached if the proper education is not there. So since I would ask the government rep here also, so in your security system in the bill, are you including at the level of quality assurance a structured training for cyber security proficiency?
Got it. So this question is for Mr. Akhil, if you want to please take this.
Sure. Doctor, it's a wonderful question that thanks for asking about that, because many people think it's a technology problem, and clearly you said it's a human problem and it's a skill-based problem, and that's the weakest link here. Yes, we did identify saying that capacity building, as we call it, the training programs that are required. And for example, right, the hospital admin staff are where the link is the weakest is usually, or a lab technician, and they might not be well versed with the current paradigm of security. So modules are being built for them in the sense that the government is issuing guidelines. So if we take it upon ourselves to even build this module, then by the time that module comes out, maybe it's outdated. But saying that these are certain policies that are supposed to be followed, and then empaneling agencies saying that this is the syllabus, please train your individuals who are at the edge because you're at risk, is the mechanism that the government is using.
Right. Okay.
See, many small organizations and big organizations in this event. Another speaker has spoken about the NCIIPC, means National Critical IT Infrastructure Protection Center. The first event they have organized, one workshop for the 10 days. It is inaugurated by the Honorable Prime Minister last year. This time, due to the elections, Prime Minister was not available in the March. Another similar kind of event it has happened in all the metros. Around 650 people they have joined in different organizations, not only the government organizations, even private people they have joined. So I request all of people go through their website. You register yourself. When this event will come, then they will invite you. It is free of cost. And they are taking the people from the entry level to the higher level of management level also. So two days program for the management levels, or 10 days program for the different levels. So they give the training, the red team, blue teams, how red team attack to your organizations. So these sort of things which happens are very practical it is. And this cost is free. So you can take this opportunity and learn yourself, and they will teach you what is the new surface of attack it is coming up, and they will give the alertness to you also. When you are registered, the mail will come that this type of attack is coming to happen. Be careful. So these sort of alerts you will get it. Great. So this sort of information you should know it, and please register it. It is free of cost, and attend their workshops in the month of March.
What is the website, sir?
NCIIPC. If you write it, you will get it in the.
Okay.
Yeah.
So this is very important takeaway for everyone. Actually, you can just Google out this. All of you can register it. It's a complimentary thing. So if I just summarize, cybersecurity is something that we cannot ignore now with the kind of risk, not only for the healthcare, but even for our families actually. There are a lot of events happening. There are a lot of case studies which are available. The only way is that we have to keep on improvising our checklist with help of the government, with help of our private, informations which are available. So, thank you everybody. We hope that, all of our points that we had discussed was fruitful. There were some takeaways. We are available over here. In case if you have any other questions, we can take off stage. Thank you so much everyone for your kind patience and cooperation.